and a lot of research has been done. Back in 1988, they first implemented, 2008, hands-free, not hands-free, you have to put the hand to the chest for CPR, but they decided you don't need rescue breaths anymore. So if you see an adult that goes down, you start chest compressions, you don't give rescue breaths. And that is based upon research done by the American Heart Association that shows that as you're giving chest compressions, your blood pressure goes up to an appropriate level to perfuse your heart. When you take your hands off, that perfusion pressure drops off. And when people would go from giving chest compressions to giving rescue breaths, the perfusion pressure or the blood supply to the heart itself dropped off. And they realized when they did this over and over again, they were having more harmful effects than beneficial effects. So they changed their guidelines based upon that. So now it's hands, or no breaths, just hands, CPR. Now, once again, as I was watching Damar Hamlin get rushed off to the hospital, I knew that they said, well, he's going to be taken to the hospital, he's in critical condition, and they put him on a ventilator, but they also were freezing, or they were cooling his brain down, because once again, the American Heart Association did research showing that it's not just getting them to the hospital, but it's how you treat them in the hospital. And they know that cooling the brain down will help preserve brain function. So that's usually for 24 to 48 hours, and then they start the brain warming back up again. So we knew that he was, and when you're doing that, you want to be intubated. You don't want to be awake for that whole experience. And so he was intubated, and then eventually let him wake back up again. And as you know, there was an outpouring of support for Damar Hamlin as he went through this challenging time. And obviously, what happened to him was just a freak event. And while I haven't read his charts, I'm part of a international group that discusses challenging cases on children and adults that have arrhythmias. And our group's thought was that he had what's called commotio cordis. Now, probably the only person that knows what commotio cordis is, other than Rod, because I told him one time, is Doug Barron. But commotio cordis is a critical blow to the chest at just the right time. So we all know the heart electrically activates and then electrically resets. And I think when I explain it to my patients, I tell them it's like a toilet, right? You flush the toilet, and then the tank's got to fill back up again. So it takes a lot longer for the tank to fill back up again than it does to flush the toilet. Well, the heart electrically activates within 100 milliseconds. It takes 400 milliseconds for it to reset. And it turns out that that reset time is critical. And about halfway through that reset time, half the cells in the heart are ready to go, and half the cells in the heart are not ready to go. So you've got this, what we call heterogeneity within the heart. It's a very critical time. And if you get a blow to the chest, right in the middle, when half the cells are ready to go and half the cells are not ready to go, you can set up an arrhythmia that causes sudden cardiac arrest. And that's what likely happened to him. He got a blow to his chest right at that critical moment when half his cells in his heart had reset and half hadn't, and it set up this tornado of activity through his heart. And the way you treat that is you do chest compressions, then you shock them back into normal rhythm. So that research is actually done with support from the American Heart Association. So what they did is they actually had an animal model where they would time baseball-like object being projected at the animal's chest, and they do it at critical times, and at certain times, 6 out of these 17 animals, when the ball would hit the chest at just that critical point, these, actually as pigs, would go into ventricular fibrillation. So that's how they knew that that's what caused these sudden cardiac arrests. Now, the population that's most vulnerable is actually the adolescent boys, because their chests are much more pliable, and so it's the T-ball or the baseball, Little League baseball is the most vulnerable population. But it can happen in hockey, can happen in field hockey, can happen in softball, can happen in soccer. There was even an event where a father was teaching his son how to tell time, and he started pounding on his chest, and he put his child into a sudden cardiac arrest. So, but as frightening as that sounds, think of all the football games that have been played and who've never had a sudden cardiac arrest like that. So that's how rare these events are. But in my world, I've seen them happen frequently. And also, as I sat there watching them take care of Damar Hamlin, I thought of the boy just that week before that who had been playing basketball with his friends in a pole barn in a small town in Iowa, actually outside a small town in Iowa, who collapsed and his mother gave him CPR and he survived. The EMS arrived and they shocked his heart. He did not have millions of NFL fans cheering for him, praying for him. He did not have the NFL Association, NFL Players Association supporting him. He did not have an outpouring of support for his charity, which is to give toys to children. He was brought to the hospital in an ambulance. He recovered for 1 week, and we put what's called a defibrillator in his chest, and he's back at home now. The next week after that, a boy in Des Moines he goes to sleep. He's got a fever. His brother walks in, tries to wake him up. He's not breathing. His mother picks him up, takes him to the bathroom. Mother picks him up and then does chest compressions. He survives. He comes to the hospital. No fanfare. No all-purpose support across the nation. He went home this past week. Survived because of CPR and defibrillators, and the research has been done. And so the question is, this is a challenging part because we don't have the ability to put a child in NFL Monday Night Football, but we have to help these children. You know, each year in Iowa, we have about 35,000 deaths, 35,000 births, not deaths, 35,000 births, children that are born. Of that, about 300 will be born with congenital heart disease. Of that group, 75, if they don't get some sort of intervention within the first week or two of life, they will not survive. It is the #1 birth defect in the US. If you take out of 100,000 children, young adults between the age of 12 and 25, the risk of a sudden cardiac arrest is between 2 to 4 per 100,000. And despite all our efforts to try to identify these people, these children that are at risk, we will not catch them all. We have to find some way to help these children. And the way I think about it is, I ask this of the medical students, and they almost always don't raise their hand, but who's read the book Catcher in the Rye? By J.D. Salinger, yeah, right. Far more than the medical students have read it. I thought it was required reading. J.D. And the main character is Holden Caulfield in that book, and he's a bit of a lost soul, right? And his friend was sitting down talking to him, saying, "Holden, what are you going to do with your life? What, you need to have a path." And he said, "Well, I don't want to be a lawyer because all they do is drink martinis and play golf." And I thought, that's not a bad job. And he said, I don't want to be a doctor because I'm not smart enough. So, as the people will know from the name of the book, he wanted to be a catcher in the rye. And the catcher in the rye was the person that would stand on the edge of the field of rye next to a cliff while the kids were playing, and he would run and try to catch those kids that would get off course and run towards the cliff. So he would catch these kids and put them back on the playground again. And I think to myself, this is my job. There are the kids out there that didn't get identified with heart disease, but are still at risk. And we have to, me and the team and the people across the country, have to figure out a way how to catch these kids, identify them first, and then catch them so they don't fall off the cliff. And that's the boy in Des Moines that had that cardiac arrest. That's the boy in that small town Iowa playing basketball in a pole barn. And I can tell you, I saw a child on Monday that had a cardiac arrest while playing volleyball. And it's all those things that were set in place by the American Heart Association that got those kids to us and they got them back home again. Now, what I'm asking is, people to join me and help me be a catcher in the rye and help support the American Heart Association so we can do a better job identifying these people and then making sure they don't fall off the cliff. So that employee, I actually, Nikki, you're very kind to say those words. I have a really great team that's working with me. And the great thing about the Heart Walk is also you get out and you walk. But also it's a great event, and I'm not here to say you have to get out there, but I will tell you that as you think about, all the great things that's occurred in your life and what you're thankful for, thank the American Heart Association. I know I do, and I continue to, so thank you. There is time for questions. Mary, how did I do for speed okay, good. And she's a tough critic. So, any questions about American Heart Association? What we're doing, what the next advances are. One thing I forgot to mention was in 1988, the American Heart Association recognized that women were underrepresented in research, especially heart disease research. So there was a tremendous push to say, this is not just a disease of men, this is a disease of women. And a lot of research and dollars have gone into better understanding women's heart disease, because if you're a woman, you're much more likely to be sent out of the emergency room with anxiety rather than a heart attack. And far more women go outside, get pushed out with anxiety than men do. So we need to do a better job.
What are the basic signs of a heart attack in women?
Yeah, so
Repeat the question.
what's that? Yeah, what are the common signs of a heart attack in women? And the classic ones are that crushing chest pain, the radiation of pain in your neck, down your arm, sweating, but it can be nausea, and it can be this sense of doom, and those kind of all overlap with anxiety. So you can have a fast heart rate. Obviously, passing out would be something to be worrisome. Hopefully, if you pass out and get to the emergency department, they're not going to send you out with just anxiety. But those are the classic ones. Yeah.
Very briefly, because I know Joe Biden's on the mind of some people for the speech.
Right.
I find it interesting that I went to a college in Iowa in the early 50s, and they had a new student week. It took about 5 days to orient students to what the college did, what it stood for, where certain buildings were, and so forth. And one evening, the women collected in one dormitory lounge, and the men in another one. And for the men, it was called a freshman smoker. And we were each given a pack of 4 cigarettes. That's not been done now for some time. But nobody thought a thing about it.
What did the women get?
This was about 1952, 53, 54, on there.
Yeah.
Along that line, when did soldiers quit taking their cigarettes?
Yeah, that I don't know. And I'll put that back out to the audience. The question is, when did soldiers start not getting tobacco or cigarette in their dock kits and supplies? I have no idea.
I have a question. When a person has a defibrillator,
Mm-hmm.
do you have somebody now that's able to read those?
So, yeah, obviously defibrillators have been miniaturized. So the first defibrillators were all external. Now we have defibrillators that can be put in these. Obviously, when you put them into these children, they're much, much smaller. One of the big advances that probably came out about 10 years ago is that they have remote monitoring. So it used to be when someone had a defibrillator and they had an event, they would have to go to the emergency department, and they would hopefully have someone there that could interrogate it, which means they put a wand over the top of it and download the information. Now, all that information can be sent via their smartphone. So they've got they've always got an app, right? But they've got an app that will communicate with their device, and it will actually do automatic recordings and send them to our office. And just this afternoon, we had a patient that was, I do a clinic in South Dakota, I'll be flying there on Thursday. One of the patients had their device sent a message to their phone sent it to Medtronic, and Medtronic sent it to us, all in the course of about 15 minutes. And we could diagnose the problem. So when I see her on Thursday, we will reprogram her device. So it's a huge advancement. So yes, we do follow those defibrillators closely, and a lot of it's very much automated.
Okay, stop. For instance, if someone needs one, will they tell them that we can't do the procedure because we don't have enough people to read these?
I don't, reading so the question is, will there ever not put devices in because they don't have enough people to read the tracings? That process has gotten much better. So, I read, when I go home tonight, I'll maybe looking at some tracings on a defibrillator. That I don't think is a rate limiting step. The rate limiting step now is making sure devices last as long as they can, right? A defibrillator, if you put inside the body, will last 10 years. Well, I'd like it to last 15 years. I like to lead smaller so they can go in children. I like to make them more sensitive to make sure they detect arrhythmias and not deliver shocks when they shouldn't. So we're getting better at that. It used to be that if you put a defibrillator in a child, there's a 1 in 4 chance that they would get an inappropriate shock, which means they got a shock when they shouldn't have got a shock. That's gotten much better. Far and away, they save lives, but they are not perfect.
Okay, every so often, my husband will have to go in and have a reading.
So you have to, as the new technology comes out, there'll be new ones that you don't require them to go in, so it'll communicate with a smartphone or a bedside monitor. So that's one of the things about having newer devices that come out is the newer devices incorporate that new technology. So I want batteries to last a long time, but I also want the latest technology, and there's a trade-off.
Yes, the percentage of women versus men who require pacemakers, seems to me it's always been men that I've heard of who get pacemakers, but is there a difference? Is there a percentage more of women or men?
That is a great question. There are more men that have heart attacks than women. Mm-hmm. And by the way, we talked about in the 1960s is about 1 million people per year. Now we're under 400,000, about 360,000 out of hospital cardiac arrests. So we've gone from 1 million down to a third of that over those decades. I don't have those numbers, but women are at a lower risk of heart disease than men. So that would
mean.
Yeah, the pacemakers are often a result of aging and heart attacks.
Okay, thank you.
Yeah.
You hear a lot today about brown and black children, babies that are die more quickly than Caucasian babies. Could it be because some of them have heart problems that are not diagnosed?
So the question is, and actually this is another, you bring up a great point, almost like you're planning the audience, how there are ethnic and racial disparities in the healthcare we provide. And the question was, are black children at a higher risk than white children or other children of color of having a heart disease misdiagnosed? And it is true that they don't have, as a nation, we don't have the same healthcare. There are healthcare disparities, and we need to do a better job with that. So, and the American Heart Association recognizes that. The American Heart Association also recognizes that food insecurity is a big issue. And so you think of a heart association doing stuff with the heart, but they also realize that food insecurity is an important issue to address. So they actually have a push to improve healthy food distribution across the nation. So also have the healthy drinks, reducing the sugar content in drinks too.
Ian, wonderful presentation. How can somebody, not to be set up for you, but how can somebody, one of the members of Oak Knoll inspired by this get involved in the Heart Walk and or the Heart Association's efforts on this front?
Actually, I think just going out and, so does everyone know when Mother's Day is? Right? Yeah, my mother reminds me every year. So it's the Saturday before Mother's Day is when the Heart Walk is. So that's that May 6th. The first thing is just go out and support the group, right? I mean, and I think it is remarkable walking with people, children and adults that have had heart disease that are still survivors. So we have a survivor's wall. So that's number one, just show up. And number two, for yourself, walk a mile. Walk a 5K, 3.2 miles. That's good for your heart. At this event, there are a lot of activities that promote healthy hearts, and also there's a CPR station. So when you go there, you can learn hands-on CPR. You can learn about heart-healthy food. You can learn about all the other great things that are going on with the American Heart Association. And then, of course, there's a website, and you can donate. You can have a team get together. If you want to donate, always donate to me instead of Rod, because Rod outpaced me last year in donations. So do not give to Rod, give to me. And I think, just in general, spread the word to your friends about the signs of a heart attack, about the importance of learning CPR, because you may be the person that saves that child or adult or friend. So, yeah.
What about having classes for parents when they have these children in the hospital? You have to have a class before they go home with that baby.
Yeah, that's been a big push for across the nation. So now the American Heart Association, I mean, I'm going to go off on a tangent, but the question is about having classes for CPR for the families. We give the family packets, not only for them to learn CPR, but when they go home, so for the other care providers, the grandparents, the aunts and uncles, the friends that will care for their children, they can learn CPR, and we give them an inflatable doll for those children that go home. But also the American Heart Association has pushed that every senior, before they graduate high school, take CPR course. And it's a great idea. The problem is, it's an unfunded, like many things, it's an unfunded mandate. And so the oversight on how it's being taught, who's teaching the class, are they just getting a card because they walked through the nurse's office, or are they actually learning CPR? And so we have a big push to make sure that requirement for seniors in high school to make sure they have CPR training is a more structured program.
Our daughter, when she first started teaching her first year, a child collapsed in her room. She had seen CPR on TV, but never taken classes. She said,
Yeah, it's not, I hate to say this, but it's not rocket science, right? If you know the song Staying Alive, I'm not going to sing it because it'll be terrible, but that's the song, Staying Alive, and there I am singing it, Staying Alive, Staying Alive. That is the rate of chest compressions. It's now 100 beats per minute. Staying Alive, Staying Alive. In Michigan, we did to the Michigan fight song, Hail to the victors, valiant. Hail.
That's why you lost a lot of patients.
Yeah, that's right. we don't do that
You
anymore.
would have tonight over here.
There you go, fight. A little bit faster, you gotta fight. Fight for Iowa. Okay, there you go. That will work, yeah. So there's been a lot of great things that have been, as far as at the state level. So one of them was getting seniors in high school, or sometime in high school, you have to learn CPR before you graduate. Another thing they did that it seems like a very straightforward thing, but when a child's born, we talked about those 320 children that are born with congenital heart disease, and 75 of them in Iowa, 75 to 80, will have critical congenital heart disease. And if they don't get intervention, they won't survive. So it's now, and actually back in about 10 years ago, we went to the state capitol with the assistance of the American Heart Association, and it's required that every child when they're born have a pulse oximetry. They check their pulse and their finger and their toe, and if they're more than 3 points different, they have to recheck it. And they also do a blood pressure in their arm and leg. And if you do that, and there's a difference, and it gets identified, you'll pick up 75% of critical congenital heart disease. So it's a very simple measure, but it's an unfunded mandate. So if you've got a nurse who's working hard in a small community hospital, and she has a newborn, and she checks that saturation, and they're different, and then she does it again after 5 minutes, and they're still different, she's got to make some phone calls, and it's my responsibility to make sure there's no barriers for her to say, I want to call the University of Iowa, I'm going to call Mercy Hospital in Des Moines, I'm going to make that phone call, and someone's going to answer me and help me with this child. Because doing that work and then having that child not get to the right center is just as tragic to me. So as a division director of pediatric cardiology, it's my job that whether your child is born across the street from Kinnick Stadium or in Sioux Center, your child gets the same care. And so that's part of that mandate, to get it identified and then get them to the right place.
What is the success rate of inserting the leads for a defibrillator?
Well, what the question is about how successful is it putting a defibrillator in, and the technology now is very good. So if you look at the complications of it, one would be infection, bleeding, that sort of thing. It's all less than 3%. The vast majority do very well with defibrillators. It's
I'm thinking about when you insert to get this started. Is there a risk to that?
Yeah. When people ask me, is there a risk? If a doctor tells you there's never a risk for a procedure, then you need to find a new doctor, right? Because everything has a risk, and that's what's shared decision making. But whatever and this is true for any disease you always look at the risk and benefits, right? And if the risk is much greater than the benefit, then we don't do it. Now, with defibrillators, the risk of getting a life-saving shock is incredibly high. The risk of a complication of the procedure is very low. So, the vast majority of the time, getting a defibrillator, if it's indicated, is a safe choice.
Thank you.
Doug?
What you didn't point out is of these kids that are identified, virtually every one of those kids is now corrected.
Right.
They can all be saved, so it's.
Yeah, so, Doug brings up a great point that it's you identify them, but the reason why you want to identify them is because the vast majority of them can be saved. We can do a surgery, and we've got a lot of children out there that walk around with only one ventricle in their heart. As a matter of fact, if you come to this year's Heart Walk, there's a boy who's got one ventricle in his heart. He's had 3 surgeries, and he will walk with you, and you will not be able to pick him out of the audience. And that means that we all did a good job getting the technology, the research, the great minds like Doug to get him to the point that he can do that. So live a full life. He will not live beyond 40, 50 years, but he will live 20 to 30 years, and then hopefully we'll have more advances. What we know about medicine doubles every 2 to 3 years. Imagine that. What we know about medicine in 2 to 3 years, we'll know twice as much. The Library of Congress doubles every, I think, 6 years now, what we know in the Library of Congress. Medicine doubles every 2 to 3 years. So imagine being that poor medical student who, by the time he starts medical school and finishes medical school, there's 4 times as much information out there. So now it's just a matter of how do we access that information and utilize it. So yeah, it's remarkable how much we're learning. A lot of it's on genetics, on new technologies, new techniques, better diagnosis, all these things. It's doubling every 2 years. So what we're doing for these children now, and the parents say, what are their options? I'm thinking, there's going to be a lot of options down the line because all the research that's being done, all the advances that are being made in science. So, and whenever we do make an advancement in Iowa, my goal is that it gets disseminated. I don't want people to come to Iowa to get a procedure that I mastered. I want that procedure to be done everywhere. So right now, more than half the procedures I do, I don't use any radiation in the cath lab. About 60% of them, I never have to use any x-rays. that's great for the children that come to Iowa, but why should that just be at Iowa? Why can't that be everywhere across the US? So my goal is to publish the research and make sure everyone else learns that technique too. We do great things here at Iowa, by the way. We're just very humble, we don't talk about it much. But there's been tremendous advances that are done here in this, in the state of this institution. So, University of Iowa is a great place. I've been here 22 years and I plan on staying. There's everything I wanted to accomplish in my career, I accomplished at the University of Iowa.
Is it true that that helicopter that's flying around is picking up babies in Davenport and bringing them to you?
The question is, the helicopters that go out, do they come from Davenport? They go all over the state. If there's a child that's identified that has critical congenital heart disease and they need to be brought here, the helicopter often goes out to pick them up. No, we always wait. Sometimes they can go in an ambulance, but we have the medical helicopter that flies right over my house. I know when it's coming over, so you guys probably do too. Any other questions? I can't tell you how much I appreciate you guys coming out tonight and joining our team. If nothing else, just to tell someone to take CPR. Nothing else to help someone recognize the signs of a heart attack. You know, and maybe join our walk. I have a great time, so I hope to see some of you. Hope to see all of you. So, thank you.